Next up, we have a question from our own college interns over at Korean American Civic Empowerment. They've been doing a lot of research this summer, and this was the one that really piqued their interest. It has to do with our medical practices and how we afford medical care in this country. So the topic summarizes the challenges posed by medical insurance companies and their impact on small medical practices. So it seems it's a two-part question. So the first one is to address the structural issues that lead healthcare providers to avoid insurance-covered services. Would you consider legislation to enhance accountability and transparency in the insurance industry? And the following question for part two is, would you support the establishment of a federal level dispute mediation body between insurance companies and medical providers to protect doctors and small healthcare practices?
Well, these are super specific questions. I will be honest, I don't know a lot about this topic, but more transparency to provide more affordable access to healthcare is always a good thing. It just feels like it's getting more and more complicated and more every day straying away from the most important goal of actually providing affordable healthcare for people. So I would love to work with our young experts on this issue. Would love to support legislation that would make the process more transparent and whatever type of potential mediation or arbitrator could be helpful in the process to protect both our healthcare practitioners who are essentially small business owners, especially here in Queens and New York City, and to help them deal with one of the Goliaths of their industry, the insurance companies.
Yeah, so I just was at a hearing last week or a couple of weeks ago in the Ways and Means Committee about Medicare Advantage. And there was a lot of testimony about insurance companies that, number one, give a big hassle to patients and to doctors, providers, for what they call prior authorization. And it takes forever to get prior authorization. You jump through a lot of hoops and make it very difficult. And then the insurance companies, when they apply for money from Medicaid or Medicare, which are two of the biggest funders of health insurance in America, they do what's called upcoding. They make it seem like the patient is sicker and they need more tests and more this so that they can get higher reimbursement. And it's very complicated. Nobody really has a good answer to solve the healthcare problem in our country. We know there's a problem. We spend more than any other country in the world. Our life expectancy is going down. We have a higher infant mortality rate than a lot of other countries, and we're not getting the good results that we should be getting. If you have a good hospital, good doctors, you're lucky, and good insurance, you're lucky. But if you don't, you're in a lot of trouble. So we got a big problem in our country. But there's nobody's laid out like this is a good answer to how to fix it. As far as an independent body, I actually proposed and implemented, I helped pass a law called the No Surprises Act, which required independent dispute resolution, which said that if you show up at a doctor for like an emergency room, or you show up at a doctor that you have to go see, and then you're not in the plan that doctor carries, you're out of network. Well, then the decision about how much gets paid by the insurance company to the doctor or to the hospital is subject to an independent dispute resolution. So it was great. It was a big fight. It was a big deal for us to get this law. It was designed to protect the patients so they didn't get hit with a bill that they didn't expect to come. And we had a fight to protect the doctors and the hospitals that they didn't get taken advantage of by the insurance companies. The problem is that the insurance companies were then abusing the independent dispute resolution process. So I sent a letter to the then Secretary of Health and Human Services and to the insurance companies and said, hey, we're watching what you're doing. You got to stop monkeying around with this. So it started to get a little bit better, but it's really a major battle. And a lot of these big companies United and Cigna and even CVS and CVS Health and Anthem and Empire Blue Cross, they're kind of like gaming the system a little bit. So we are trying to just pay attention. But again, this is a very complicated area, and we're fighting to try and get people to pay attention to it. And again, in this current environment, everybody wants to keep things simple and yelling and screaming instead of talking about the details. So this is a very complicated area of the law, but I mean, it comes down to some of the basic things that people like Grace and I are fighting for the little guy, and some of our opponents are fighting for the big guys. So that's what it comes down to in simple terms.